Hey guys, I'm Reagan, and the patient-rated outcome measure that I chose was the ACL Quality of Life Questionnaire. The next slide is actually going to show you what the ACL Quality of Life Questionnaire looks like, just so you guys can get a little idea of what it is and how it works. So this is what the questionnaire actually looks like on paper. So if you were to take the questionnaire in person, this is what it would look like. There is also a second page of additional questions, but it just didn't fit well on the slide. But I just wanted to show you guys what it actually looks like, so that way you kind of get an understanding of what I'm going to be talking about, and we're going to go into more detail about the different sections on there in a little bit. So the questionnaire is designed specifically for those with ACL tears, and it consists of 32 questions that use a 100 millimeter visual analog scale. And so there's 5 categories of questions, and the first category is symptoms and physical complaints, which has a total of 5 questions. Next is a work-related concerns section, which has 4 questions. And then there's also a 12 question section over recreational activity and sports participation. And then next is a lifestyle section, which has 6 questions. And then lastly, there is a social and emotional category, which has 5 questions. So the total of all those categories adds up to 32 questions. And I put an example of one of the questions on the slide just so you guys could better visualize how the questions are set up for the questionnaire. So the ACL Quality of Life Questionnaire was originally developed by Motati in 1998, and it was originally developed with patients who had chronic ACL deficits. However, this questionnaire has recently been validated that it fits a much broader range of ACL injury and tears. The development of this patient-rated outcome was actually completed in 4 stages by Motati and his colleagues. The first stage was item generation, and this used 167 items. Next was the item reduction stage, and this was done by surveying 79 patients. Next was the question formation and pre-testing stage, and this was completed on 20 patients. And lastly was the stage where they looked at reliability, responsiveness, and validity, and this was completed on 100 patients. So this questionnaire has actually been translated and adapted into several different languages, finding great reliability and responsiveness. So it's actually used all over the world. So there are many different knee-specific patient-rated outcome measures, but this questionnaire is specifically appropriate for patients with ACL injuries. Since this questionnaire really assesses the individual as a whole while encompassing a broad range of physical and physiological characteristics, it's appropriate to use this instrument at all stages of an ACL injury and throughout the rehabilitation process. For example, this patient-rated outcome measure is appropriate to use for someone who just sustained an ACL injury 3 months post-op or even 6 years post-op of an ACL reconstruction. The questionnaire was originally developed for ages of 16 to 45, so it is important to keep in mind that if your patient does fall out of that age range, some of the questions may not be as appropriate, but you can still make it work. So the reliability of this patient-rated outcome measure was originally assessed using a paired t-test. However, reliability has recently started being assessed more commonly using an intra-class correlation coefficient, which is also known as an ICC. And this really just measures the variance between the trials. And so in a study by Lefebvre and his colleagues, they found that the ACL Quality of Life Questionnaire had a moderate reliability of ICC of 0.60. However, in a very similar study by Bryant and his colleagues, they found a reliability of 0.86. And so you can see that there's quite a difference there. And Lefebvre and his colleagues did note that their sample size was acceptable, but it was on the smaller range. So they think that that might have contributed to the variation in their reliability scores. So, in the same study by Lefebvre and his colleagues, they found that the Cronchpa's alpha ranged from 0.93 to 0.98 for the validity. And these numbers indicate that the questionnaire possesses unidimensionality. However, these numbers also indicate that there is some redundancy in the questions. So even though that they found really, really high validity for this, Lefebvre and his colleagues suggested that a factor analysis and also a question reduction really could help qualify the validity of this questionnaire. Motati explained that responsiveness is the detection of clinically important change. And so when Motati originally assessed the responsiveness of this questionnaire, he found that the outcome measure demonstrated responsiveness to clinical change correctly in 21 of the 25 patients on the repeated administration of the questionnaire. And so that equals 84% and seems relatively high, but Motati explained that more testing is required to assess the responsiveness from a qualitative standpoint. The overall score for this questionnaire is out of 100, with all 32 questions receiving equal weight. So each question can be answered from 0 to 100 in increments of 10. So 0, 10, 20, 30, all the way up to 100. And at the end, the total score is added up and divided by 32. I couldn't find any research that discussed the minimal detectable change or the minimal importance difference statistics, but I honestly thought the questionnaire was very simple to score. I had to use a calculator just to make it easier because the numbers were getting kind of high, but all I had to do was add up all the numbers and divide by 32. Since the total score is out of 100, it made it pretty simple to interpret the score. You can pretty much look at the score as a percentage, with 100 being the best and 0 being the worst. And so the patient that I had take the questionnaire currently has an ACL tear and is preparing for surgery. And so she scored a 25, which isn't great, but you can see how that is understandable for her situation. Acceptability refers to how patient-friendly the outcome measure is. My patient took this questionnaire in less than 10 minutes, and she told me that she thought the questionnaire was relatively easy to understand and that she thought the questions were pretty clear. So the feasibility of a patient-rated outcome measure refers to how clinically friendly the measure is. I found that the ACL quality of life was very simple and very self-explanatory as the person administering the test. Um, there's no training really required in order to administer the outcome measure, but I think some background research and knowledge on how to score it would be helpful because the questionnaire does not have any directions or explanation on how to score. But overall, I felt like the outcome measure was pretty simple and pretty much anyone would be able to do it. Lastly, I think it's important to note that the ACL Quality of Life Questionnaire is the only disease-specific, patient-reported quality of life outcome measure intended for ACL injured individuals. So there's not really any other outcome measures that we can relate this to because it really is the only one specific enough for ACL injuries. But although there is additional research that could be done to continue to validate this, according to Cosman guidelines, they suggest that this questionnaire demonstrates a lot of the metrics that are important for a high quality instrument. So they pretty much suggest that this patient rated outcome is a high quality instrument, meaning that it is highly recommended to use.